Hi everyone, Liz here, mental health professional. Today we're going to dive straight into a topic that has been generating a lot of interest. How is ADHD different from ADHD? If you've ever wondered about the unique blend of ADHD and autism, you're in the right place. We might be dealing with ADHD or ADHD, but there are some subtle differences. So the first difference would be sensory sensitivity. People with ADHD often experience heightened sensory sensitivity. Bright lights, loud noises, and certain textures can be overwhelming, while ADHD can involve some sensory issues, but they are usually much more pronounced in those with ADHD. The second difference is social interaction challenges. With ADHD, social challenges often stem from impulsivity and inattentiveness. In ADHD, these challenges are compounded by difficulties understanding social cues and maintaining eye contact as well. These are characteristics of autism. A third difference I would point out is hyperfocus versus intense interests. So ADHD is known for hyperfocus, where you get so engrossed in a task that you lose track of time. In ADHD, this can be more intense interests, leading to deep dives into specific topics and activities that can last for days, weeks, months, years. The fourth difference is routine and structure. People with ADHD often struggle with maintaining routines due to distractibility. On the other hand, those with ADHD may crave a routine and a structure, which is a trait normally aligned with autism. People can become if their routines are disrupted. Common in both ADHD and autism might be emotional reactions, but people with ADHD have more of a difficulty understanding and expressing their emotions due to the overlap with autism. If you're finding this helpful, please remember to like and subscribe for more mental health insights. Your support really means a lot to me. The sixth difference I point out is communication styles. People with ADHD can sometimes interrupt others. People with autism will have difficulty with non-verbal cues like expressions and body language, which makes social interactions even more complex. Difference 7 would be executive functioning. Both ADHD and autism have elements of executive function difficulties, but autism can have more of a difficulty with needing rigid planning, whereas in ADHD we need more flexible planning. We don't stick to plans as much. With autism, if you didn't stick to a plan, you would find that you would feel more distressed this way. Difference 8 would be sensory seeking versus avoiding. ADHD individuals might seek out sensory stimulation, like fidgeting and tapping. But in ADHD, there can be a mix of sensory seeking and sensory avoiding behaviours, depending on the situation and the individual sensory profile. The 9th difference might be social preferences. While people with ADHD might be socially outgoing, but struggle with impulsivity, those with autism and ADHD might prefer solitude, familiar groups, so that social anxiety and sensory overload can be reduced with autism. Difference 10 would be co-occurring conditions. Both ADHD and ADHD can co-occur with other conditions like anxiety and depression. However, the presence of autism in ADHD often brings additional challenges like sensory processing disorder and more pronounced social communication difficulties. So there are 10 differences between ADHD and ADHD. Remember, everyone's experience is totally unique, and these traits exist all on a spectrum. But if you resonated with any of these descriptions, it might be worth discussing with a mental health professional or your doctor. Thanks for tuning in. If you found this video helpful, don't forget to like and subscribe, hit the notification bell. Maybe share it with someone who might find it useful. Until next time, this is Liz reminding you that your neurodiversity is your superpower, and keep thriving with neurodiversity.